John, I've been eating Special K all day, and I'm still depressed.
Ketamine, not Special K.
Welcome to CareTalk, your monthly home for incisive debate about healthcare, business, and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
John, a sad thing happened. Dr. Scott Gottlieb is out at FDA. Are you sad to see him go?
Oh, anyone who cares about public health in America has got to be sad to see Scott go. He picked the right priorities, and he was effective at driving them through the bureaucracy. He shows the effectiveness and importance of great appointees. I think the most thing I'm most worried about is the loss of momentum around vaping and controlling cigarettes. I mean, cigarette smoking is still the greatest opportunity to prevent premature death in America. Yet 500,000 people die every year. And this is something that had been going down until the vaping industry showed up. And 48% year over year increase in vaping among middle schoolers. 4x increase of vaping in high school students. This is something that Scott Gottlieb identified, led, took on, and restricting nicotine in cigarettes, incredibly important and could save tens of millions of lives. I just really hope that momentum keeps going and we actually get the sensible regulation there. What's your perspective on
I mean, I second what you say about the vaping. Major crisis, FDA got right on top of it. It's also worth noting that he's pushed through a lot of generic drug approvals, even though maybe you thought as a big pharma person he wouldn't have done that.
Super effective.
He's also been effective at looking at the opioid crisis and trying to do something there, focusing on drug pricing. So yeah, he's definitely going to be missed, John.
So Dave, just switching topics for a moment, what is all this complaining about home health care costs going up? I actually think an investment in home health care makes sense.
John, I think you would say that given your role, but let's face it, home health expenditures are expected to grow faster than any other category of health expenditures from 2019 to 2017, including faster than drug increases. That's why people are up in arms.
Calm yourself down. We use home health care to humanize care and create more care to the home. If it's a replacement for SNF and hospital, it's going to be both popular and necessary. My biggest concern is that we aren't spending enough in home health care. And yeah, I'm advocating something I believe in, but it's also something we know something about. We know that care to the home works. A recent study that matched more hospital at home against actual admissions showed lower costs, better outcomes, fewer lab tests, fewer consults, and much happier patients who got healthier faster. I think you're going to see a revolution. That cost item is an investment. Not all investments in healthcare are bad, David.
John, here's the problem. Okay, I'm calm. I'm calm, but I'm not calm. Okay, so what happens with home healthcare is supposed to be great. It sounds like, wouldn't it be cheaper and better to be at home for a day rather than in a hospital for a day?
Yes.
So they say, great, so we'll have that as a benefit, but then people are in the hospital and in the home. I think you're right, you want to have home substitute for hospital. Too often it's just unmanaged and people are just out there taking advantage, gaming the system, spending my tax dollar.
I think that there is a role for entities like ourselves and others, managed care companies, really well-run home healthcare agencies to show the value, because not every visit is a great visit. But as a practical matter, with the aging of America and the need to move people out of institutions, we are going to be investing more in home healthcare. Deal with it.
So John, here's a crazy thing. Insulin, okay? Pretty necessary for type 1 diabetic. The prices are just spiking, even though there's all this attention about drug pricing. I mean, hasn't insulin been around for like 100 years? Or more? What the heck is happening?
I mean, it is the best example of big pharma gaming the system, rigging it, really. I mean, just in May, President Trump came out and asked for drug prices to be stopped or reduced. In July, Novo Nordisk increased its price on insulin by 5%. I mean, this is a drug that was invented in Canada and given for $3, effectively for free to the world in the early 20th century. And insulin prices, just the Humalog, Lilly's lead product, has gone up from like $27 to $275 for exactly the same drug. There's a lot of noise around drug pricing. The reason drug prices go up for standard compounds that have been around for 100 years is because big pharma can drive them up. And it's just a crime. There was one Yale study recently that 1 out of every 4 diabetics rations their insulin, that means they're going off of insulin. For a complex diabetic to go off insulin only costs the rest of us a lot more money, and it's devastating for that insulin-dependent diabetic. This has got to stop. I mean, if you saw in Mexico, they actually identified the fact that all of the insulin manufacturers in Mexico were actually raising prices in lockstep. This is effectively a cartel.
I was going to say El Chapo may have been in the wrong business, John.
This is...
Maybe they'll rehab him and bring him out. He can straighten.
No,
he can bang some heads together.
Mexican justice system is ahead of ours on this one, David.
Okay.
So David, what are you hearing about all these ride sharing, Uber and Lyft? Lyft's actually talking about healthcare in their IPO docs. What do you think about that?
So, John, the thing that's crazy is that, they're talking about social determinants of health, which is something I thought only you talk about, and Lyft is talking about it. And somebody mentioned that to me, and I'm like,
more people should be talking about it.
I think you're kidding. You're joking. Why are they talking about it? The fact is, a lot of people miss their medical appointments because of lack of transportation.
Millions.
And what they have out there besides ambulances, which people know, there's this whole category called non-emergency medical transportation, pronounced NEMT. And they're not very good. And there's a lot of corruption, and it's really expensive. So you have the advantage of Lyft, and they actually have an agreement with Allscripts to be able to order.
We don't need all of the details. I was just asking.
Oh, you were just asking. I feel fine about it. How do you feel about it?
No, I think what's exciting is new technology is starting to creep in to our kind of old sector of healthcare, and that's got to be a good thing because over 3 million adults last year missed their medical appointments because of transportation. Transportation is actually a big challenge. You're right. There is a broad infrastructure to provide for those services. But what's interesting is that healthcare, managed care, doctors and hospitals are starting to actually pay transportation providers to make sure those visits happen. Because if those visits don't happen, often people who need to get help don't get it. I think it's exciting. But the bigger theme that's intriguing is not all the detailed stuff you're talking about, but that new technology that is starting to emerge to rationalize and improve access to critical care in our industry. I think it's exciting.
Well, John, I hesitate to spell out any detail, sometimes known as fact. But one of the things that's nice about the Medicare Advantage, the supplemental benefits, one of them is actually covering this kind of transportation. I think that's a very good use.
What is supplemental benefits? Because I think helping people understand that might be helpful.
Well, Medicare now allows under the Medicare Advantage managed care plan the ability to cover services that weren't strictly medical in nature, but that are supportive, such as transportation. So it fits into that framework on the reimbursement side as well as the technology side.
Aren't you excited about these new technology
I'm excited,
companies?
John. I am so excited.
You were excited about the wrong thing earlier.
I know.
I don't know.
I may have misplaced excitement.
But the supplemental benefit is actually really interesting because what it allows folks in Medicare Advantage and the privately managed Medicare plans to do is to invest in all the non-clinical, removing all the non-clinical barriers to care, whether it's food or transportation or housing. It's a super exciting area. And the more we can bring great technology and innovation to that sector, the better.
Speaking of excitement, John, I peeked ahead at some of the lightning round questions. I'm excited about that. You?
I am as well. So, David, the FDA approved a new drug for depression, ketamine.
John, that's a party drug, Special K. I think soon they're going to approve sniffing glue and smoking. Oh, they approved that already. I think it's whatever. It's nuts.
6.5 million people suffer from depression. First new depression drug approved in 30 years. It's a good idea.
What did we learn from Michael Cohen's testimony regarding healthcare?
Well, we knew what we already knew, which is it does often pay to play in healthcare, at least for big pharma. $1 million for 4 or 5 conversations to understand the enigma of Trump. I think you would have done it for less.
Maybe, John. I think that Michael Cohen is hoping that the Special K is available in the prison commissary.
David, Medicare has a new app. What's the point?
I don't know, because I looked at it, John, and just said I wasn't covered, and I thought you might ask me about that, so I'm glad I'm not covered.
I think it's really good that Medicare is finally bringing apps and making some element of benefit determination and information accessible at a finger stroke. It's a good idea.
Meow. Did you hear about the $50,000 cat bite, John?
It was $48,000.
Excuse me.
For an outpatient procedure to get a rabies shot. Absurd. It just shows the craziness of healthcare hospital pricing. It says something that after the news of the $44,000 drug cost for a injection of anti-rabies vaccine, that the price suddenly dropped the next month to $9,000.
Yeah, but they didn't give her insurance company the money back on the previous one, and they said, no, it wasn't a mistake. Thanks for checking with me. I'm glad that she didn't need a dose of insulin while she was there.
Oh gosh.
Well, that's it for this edition of CareTalk. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for joining us. Hey there, listeners. Want more CareTalk? There's more to be had in our other episodes, so be sure to look for those and subscribe to CareTalk on your favorite service.